While all of ABL's healthcare roundtables are currently just in California, it was North Carolina that caught my eye over the past few weeks, as it's got to be one of the hottest petri dishes in the country for healthcare cost reform. Hi, I'm Amy Grant of the ABL organization, and it appears that North Carolina's state health plan, which covers 720,000 teachers, state employees, retirees, and dependents, about 7% of the state, is on track to run out of money by 2023. Medical and pharma spending in the state has been increasing 5 to 9% annually, while North Carolina's governor and General Assembly have provided for only 4% year-over-year increases. To counter these runaway costs, the state's treasurer, Dale Folwell, designed a plan he calls the Clear Pricing Project. The state health plan currently spends about $3.3 billion a year, $4,539 per beneficiary, with 80% coming from the taxpayers, the other 20% from the insureds themselves. Treasurer Folwell's plan was designed to cut spending about 10%, while increasing transparency and taking the power to negotiate rates away from hospitals and set rates based on what Medicare pays providers, plus about 90% markup. While North Carolina's 10.2 million population is just a tad larger than that of LA County, those people are spread over 53,819 square miles, more than 11 times the size of LA. Two other points of distinction from California. North Carolina's largest city is Charlotte, with a population of 826,000, compared to LA with nearly 4 million in the city and over 18 million in the metropolitan region. And North Carolina's minimum wage is $7.25 an hour versus $12 in California. Turns out North Carolinians have another problem besides expensive health care. Just last week, WalletHub released their analysis of 2019's best and worst states for health care, using 43 measures to compare the 50 states and the District of Columbia. Across their 43 cost, accessibility, and outcome metrics, a perfect score of 100 would represent the best health care at the most reasonable cost. As a benchmark, Minnesota led the nation with the #1 overall rank, with a cost rank of 2, an access rank of 4, and an outcomes rank of 9. But North Carolina ranked number 50, with a cost rank of 50, meaning its costs are very high, an access rank of 50, meaning care isn't very accessible, and an outcomes rank of 33, in the lowest third. Only Alaska came in lower, and by way of comparison, California came in 30th. Not surprisingly, when first asked to lower their fees charged to the state's health plan, only 27,000 providers and 5 out of 126 of the state's hospitals signed on to this new plan, with the Assistant Director of Finance for Moses Cone Hospital in Greensboro emailing state officials with his advice to burn in hell. Several weeks after the deadlines to sign on to the state health plan, the standoff is over. A hybrid network was just announced that will consist of more than 68,000 providers, including the hospitals, with those that didn't sign on to the state's plan being able to keep their previous agreements with Blue Cross Blue Shield of North Carolina. Chalk this up as a major win for the North Carolina Healthcare Association, which spent millions lobbying to oppose the plan, arguing that it would put rural hospitals out of business. If you've been wondering what would happen if a candidate proposing Medicare for all won the White House, we've just seen a preview.